Hi everyone, and welcome to the Australian Space Biology Health Symposium in 2021. My name is Dr. Rajput, and I'll be speaking to you about surgery in space lab environment. That's the overview of the talk. We'll be speaking about the need for surgical capabilities in space, some early work done on basic surgical skills in space flight and parabolic flights, the diagnostics that we use in zero gravity, minimally invasive techniques, telemedicine, 3D printing, and discussion about challenges on the road ahead. This is the Global Space Exploration Roadmap published in Jan of 2018. There have been many reiterations of this since the roadmap is not being very solid. But the essence of the message to pass on here was we have now started planning for missions outside the low Earth orbit. So a lot of medical and biomedical research is happening on international space stations. But the next steps will be to go back to the moon. Probably as early as 2024, 2025, the Artemis missions will be manned and unmanned, and subsequently, hopefully, to Mars. With this in mind, there is also a plan to set up a cislunar space station, which will serve as a gateway to the more deeper space exploration. Which brings us to the need for surgical capabilities. Why is there renewed interest or new interest in surgical capabilities at all? So, as we are planning to move farther away from the Earth, we're going to spend more and more time in space. There has been ongoing research in space medicine because we've now studied extensively the alterations in physiology of the astronauts, the adaptations that our body makes, and the possibility of problems. The more time you spend, the more likely you are to have medical issues. The NASA uses the integrated medical model. Every other space agency has their own medical model, which kind of predicts the event risk of say, a medical event and what will be the impact on the mission. In 2017, of the 100 medical conditions listed, 27 were likely to need surgical treatment, and that's where need for surgical capabilities comes from. Now, all the work that has been done on space medicine and physiology has the only way to validate it so far has been on board the International Space Station, which is now completing 20 years. Unfortunately, despite the extensive amount of time having spent there, the medical capabilities are fairly limited. They are, mind you, fairly advanced for what they can be on board. However, they're fairly basic when it comes to deep space exploration, especially when it comes to surgery. There are two primary problems with when we move farther away from Earth. Firstly, the evacuation from onboard International Space Station to Earth can be done within 24 hours. And as we increase the duration of space missions and as we move farther away, this possibility or this option is going to be not available to us. We won't be able to evacuate to Earth from halfway through a mission on Mars. Also, as the distance grows from ground support, there are going to be communication delays, and this is going to make it mandatory to be able to resolve medical or, more importantly, surgical problems autonomously by the crew. Most surgical work, early surgical work, was conducted on space stations and in parabolic flights. The earliest example would be the health maintenance facility and the medical restraint system designed by Dr. Bruce Hutchins for Space Station Freedom. Subsequently, the plan was to turn it into an international space station, but the health maintenance facility did not get transferred onto the way it was designed. So most work was focused on basic surgical skills, so painting, draping, restraint of patient and surgeons, achieving hemostasis, what were the bleeding characteristics, so fairly basic, and the need for surgical enclosures. What the early work found was, despite the anxiety of how this would be in a new place and new domain, once the operator and the subject was restrained, most of these things were fairly straightforward. The bleeding characteristics were different, but once you adapted to weightlessness, you could work around it. Hemostasis was not an issue, neither was safety. for either the patient or the surgeon. Um, there was a quick adaptation to zero gravity, and all basic procedures like IV infusions, Foley's catheterization, suturing, lacerations, chest tubes, all of these could be performed safely. When it comes to diagnostics at zero gravity, the options are really limited given the constraints of weight and volume. The one diagnostic instrument that has been used and researched extensively is the ultrasound. It's weight, volume, cost effective. It is very easy to use. Um, at least from ground support, crew can be trained to obtain good quality images. It is important to understand the difference in the air fluid behavior in zero gravity versus on Earth. Pneumothorax, hemothorax, abdominal bleeding, and fluid, more than 250 conditions can be diagnosed using an ultrasound probe. And once you train your eye to pick up the differences and adapt yourself to those differences, it's pretty easy to get good quality pictures. It's not technically difficult to perform. What ultrasound offers a massive advantage over any other diagnostics is that you can actually perform image guided intervention. So you can drain, you can aspirate, and do a whole lot of things. Ultrasounds have been evaluated on the International Space Station for more than 15 years now. Um, the first one was a compact ultrasound in the form of a laptop, which you can see on the picture on the right. Which was replaced by Ultrasound 2, was a smaller portable machine with better image capability. All crew was telementored by ground support, and like I said, you could get very good diagnostic quality imaging. Of recently, the Butterfly IQ is a handheld portable ultrasound, which is even available for commercial use. It's a single probe ultrasound with preloaded 7 presets for depending on what area of the body you want to scan, and it can give you pretty good images. There is ongoing work with the Butterfly IQ currently on the International Space Station, and very excited to see what the results are. Surgical endoscopy or laparoscopy had a lot of excitement around this topic in microgravity. It was performed in parabolic flights on animal models. There on the right, you can see Dr. Campbell performing a laparoscopic procedure on a restrained pig. The key difference is how the surgical domain behaves in zero gravity versus 1G. Um, you can also you definitely need gas insufflation for better visualization. There is a key that laparoscopic surgery does require a fair bit of expertise. The learning curve is high. So although this was popular an option as something that could be feasible for surgical capabilities in zero gravity, given the cost, the bulk of the equipment that would be needed, and the very large, sharp, steep learning curve that is required of the crew, there's something that I'm not sure is going to have much application in microgravity, although it offers a self-enclosed surgical domain. Like I said, so the advantage is it's a self-contained surgical field. It's quicker recovery period, can be performed under local anesthetic, has better visualization. However, there's for all the disadvantages that I mentioned, it limits crew selection, it's bulky equipment, and it requires ongoing skill refresher. And this is going to be of limited value. Which brings us to by far the most exciting topic in surgical capabilities is robotics and telesurgery. Now, telesurgery essentially means the operator is at point A while the patient is in point B, and um, the surgeon remotely performs surgery on the patient using a robot. There's widespread application of this on ground. Robotic prosthetic surgery probably is the most famous one using the Da Vinci model. There are many advantages. The dexterity, the precision is unique. It's minimally invasive. However, when it comes to application in space, I think one of the biggest disadvantages is latency. So the farther the distance between point A and B, between the surgeon and the patient or the telementoring, the further the safety degrades. So the maximum latency for safe surgery is quoted to be about 500 milliseconds. Unfortunately, the latency between Moon and Earth is on an average about 3 seconds for communication. So I don't think we can perform robotic or telesurgery safely in space. You can't even start to think the latency between Mars and Earth, depending on relevant positions of the orbit, could be anything between 6 and 20 minutes, and this would be rather unsafe unless there is a central informatics network on the that the crew have access to and have onboard assistance. Obviously, there's going to be limitation of weight and volume, and it does require advanced training to perform this safely. One of the applications potentially could be once there are established colonies on the lunar or Martian base, where you could use robotic or telesurgery for treatments in those colonies, and that is something worth exploring. Robotic surgery in space does have a role for humanoids. So humanoids are human-inspired dexterous robots, and they might have the right combination of functional characteristics to be useful for either assisting a human surgeon. R2 is one such humanoid who's stationed on the International Space Station since 2011. It's a versatile robot with dexterous hands, aids its precision, has stereo vision and tactile sensors for real-time tasks. In experiments on ground and on space station, he's given a hand with guided intubation, performing ultrasounds, and handling syringes. Although this is in fairly incipient stages, very, very early stages, the role of R2 or a humanoid robot needs to be clearly defined. There's limited application of how this humanoid could be a primary surgeon, but definitely could be an onboard assistant in a more collaborative manner. The key role of a humanoid is probably where there's an element of fatigue or danger to the actual crews, when the humanoid can help out. Which brings us to 3D printing, which from a personal perspective, this is one of the most exciting things about performing surgery in zero gravity environments. So one of the major considerations is surgery as a specialty or as a treatment modality is fairly instrument dependent, fairly bulky, fairly task heavy, and you need a lot of equipment. And it's given the weight volume restrictions on any space mission, this is not a luxury we would have anyways. Mind you, any surgical emergency or the possibility of a treatment of a condition needing surgical treatment is very, 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 very low, even if you consider a mission to Mars. However, the impact is very high, so you do need everything you could postulate and needing, and that's where 3D printing is really helpful. 2014 is when the first 3D printer on the space station was installed. It has been validated, so 3D printing is safe and feasible in zero gravity. There is a potential for printing medical supplies on board, perhaps using a template in a central network. A good 3D printer from a surgical perspective should be able to print surgical supplies, surgical instruments, should be energy efficient, should be able to do it in time, given that if it's an emergency, you probably need it very urgently, and should need minimal post-processing. And remember, all surgical instruments need sterilizing, so the material used should be sterilizer friendly. What you see on the right are pictures provided by a ground mission using 3D printed surgical instruments, and you can see the metal instruments on the left and the 3D printed instruments on the right. So having gone over a brief summary of or a brief introduction to a lot of the aspects of surgical care in space, if we really need it, the key challenges are going to be there's going to be no real-time guidance, or there's going to be no ground support. So we're going to have the need for autonomous care, we won't be able to evacuate to definitive care depending on where we are, either going back to the moon or going to Mars. Crew selection, I think, is going to be one of the most important and the key factor. Should you have a surgeon as part of the crew just to cover surgical problems? Not really. Don't know. Should you have a doctor as part of the crew, which has been done before, or do you just train the crew, the astronauts? Currently, the astronauts require or undergo between 60 to 100 hours of medical training, and I suppose for most surgical care, you would need much more than that. So crew selection is going to be a key tenet or a principle to address providing surgical care. In my honest opinion, you would need a crew medical officer who has skills of a old-time GP out in the countryside, who could do a lot of stuff by themselves. Simple procedures could be carried out. That's something to consider. The other consideration of the challenge is volume of the spacecraft and the design of medical systems, which brings weight and volume restriction of what you can carry. Another challenge is adaptation to weightlessness, and mind you, this is not just for the surgeon, but it's also applicable to the patient, because to give a simple example, the distribution of fluid physiologically in the spaces in the body sort of results in a depleted intravascular volume that is equivalent to a class 1 trauma. So there is adaptation to weightlessness that we need to be mindful of. Training and maintenance of skills. If you're on a mission to Mars, a year and a half, and these are not things that are going to happen every day. So the crew is going to need to train and maintain the skills. You're going to need a health, sort of a health corner or a bed at least, with monitoring systems. Role of prophylactic surgery. There are going to be, I'm aware that there are other speakers who are going to be covering this. Infection control. It's going to be a closed space that is going to be shared by the crew members. So any surgery that is performed in such space needs to have very, very rigorous infection control. And the last thing is going to be convalescence and rehabilitation. Once, even if you do end up managing to perform any surgical procedure, we have got to maintain health of that person, whether it is crew, so that they can recover safely. So the road ahead, we're going to need advanced life support systems to support suctions, restraint, waste disposal. There's going to be realistically an increasing move towards conservative management. So say of appendicitis, cholecystitis, if needed, we can use diagnostics like ultrasound to diagnose them, and then use ultrasound guided therapeutic procedures. We'll need development of multi-purpose tools with varying capabilities that could be used with a surgical enclosure. Ultrasound is likely to remain the mainstay of the diagnostic modalities. 3D printing with more refinement and metal on its way can be a very viable solution to replenish supplies on board. Laparoscopy, although has a role, design and volume will need rebuilt. The humanoid, I think, is a very promising multi-purpose coactive design that will be helpful to aid the crew medical officer with a lot of the procedures, and a centralized informatics network for storage of templates, say for 3D printing, for algorithms of most common surgical emergencies, and for training modules for maintaining skills of the crew is going to be very, very important. That is sort of the nutshell summary of surgical capabilities in space. In interest of time, there's only as much we can cover. These are very useful references. And thank you very much. I'm part of a group called the Space Surgery Association. You can find the details on the slide, and if you want to get in touch, contribute, or collaborate, please feel free to reach out on the website. Thank you very much.